Good afternoon, everybody. Bob Brisky here at Pinnacle Financial Services. Welcome to a webinar presentation that we're going to do today on an exciting topic, one that's been hot in the world of Medicare insurance agents, a pretty hot topic, the new Medicare Plan Finder and how it's really going to impact us here coming up in the annual enrollment period and beyond. So just to get things kicked off, let's do a couple of quick housekeeping items. First off, got a lot of people on the call today, which is great. We do have it on mute. There is, I should say, the ability to type in any questions you have, and this way we can answer those questions during the presentation. We're also always available after the call to answer any additional questions one-on-one that you may have on the topic today, and anything else related to Medicare for that. Now, I expect we'll probably go half hour, 45 minutes maybe today. Depends if we get a bunch of questions or not. So let's jump right into this. Also, we're recording today. So if you do need a copy of the webinar, you want to listen to it another time, you think somebody else in your office there should also get the most up-to-date information on the Medicare Plan Finder, I'll be happy to get that over to each and every one of you if you like it, and you can listen at your leisure. So with that being said, let's jump right into this Medicare Plan Finder presentation here. All right, so first off, Medicare Plan Finder. We got the announcement a couple weeks back that the new Medicare Plan Finder was coming out, and of course, probably due. I mean, the old Medicare Plan Finder has been around for a long time. A little antiquated in many respects. The overview of it, the way it looks, the way it sort of gives data. It really did need a little bit of a facelift. So I think there we have some good news with the new Medicare Plan Finder. But what we saw when the announcement came out and we were on a web presentation that CMS was giving on the new Medicare Plan Finder, something that jumped out at us right away, for not only us here at Pinnacle, but for our agent distribution, was that the new Medicare Plan Finder was not going to allow comparisons to be run unless an individual was actually signed into their Medicare account. So a bunch of red flags jumped up, obviously, from the get-go when we saw this. The first thing being, obviously, what if somebody doesn't have the ability to sign up for an account yet? Doing a little, they're 64, they don't have their Medicare ID yet. You're working with them, you want to get some plan info together, take a look at some of their prescriptions, do a little fact-finding. Without the ability to run it, that was really going to hamper some of those pre-sale opportunities. So it really, that jumped out at us right away. And then secondly, in looking how they were going to give the information, it really wasn't going to give the ability to run prescription drugs in the same way, and the output's still going to be a little bit different, but the output wasn't going to sort of tally everything for you. So overall cost of all the prescription drug plus the premium of the prescription drug plan, and you could always sort it by what was the best plan for the client based on all costs associated with the plan, premium and drug costs. So they changed that, and they're kind of standing firm on that. So you got to do a little bit of addition, even in running the plans now versus the way they were previously. So that's something that's still out there. But my message here is that there is some good news. Over the last couple of weeks, one of the executive vice president here, Angela Powell, who's on the Medicare Advisory Council for NAHU, the National Association of Health Underwriters. And those of you not familiar with NAHU does a great job at lobbying for all things important to insurance agents when it comes to everything from health insurance to Medicare, and how to make sure that we have a voice in the government, so that things aren't obviously done that's going to impact our livelihoods and our ability to do business. So NAHU does a great job at speaking up for everybody in the insurance world. And what the Medicare Advisory Council really, when they saw this, was able to do was get in front of all their contacts, the powers that be, at CMS, and really talk to them about the ability not to be able to run quotes without having the account in some way or shape or form. So the sky was kind of falling a couple of weeks ago. The good news is that they've sort of backtracked on the ability to do that. So now you can run drug comparisons without logging into the actual system. The new Medicare Plan Finder. And by the way, the new Medicare Plan Finder is completely taken over for the Plan Finder. The old Plan Finder's going away. You're not going to have the ability as of, we're being told October 1st, October 1st, 2nd, for this AEP season, especially important to know, the old Plan Finder's going away. The new Plan Finder is actually live right now. So I wanted to show everybody the new Plan Finder. So here you go. And I can send you a link to this. So if you want to type in the question box, hey, send me a link to the new Medicare Plan Finder so I don't have to try and figure out where it is on Medicare.gov. That's no problem. We can do that for you as well. But it's out there right now, and it's live. It's going to completely take over, like I said, in the next month or so for the old one. But we do now, look at this, continue without logging in. So you have the ability to log in and create an account, or continue without logging in. So I want to spend some time here taking a look at, all right, we want to continue without logging in. So what can we do? We can do a lot of the same stuff we could do before. Learn more about Medicare options before I see the plans, and we want to view some plans. Let's just say we want to look at Part D plans. Here we go. We want to put in a zip code. I'm just going to put in the zip code of our office here at Pinnacle, 18974, right outside of Philadelphia. Check. I'm just going to actually say that I don't have a Medicare number, right? I'm going to put in my date of birth. Let's just say I put in 55, telling me I'm under 65, obviously. I'm going to say I don't get any help. You want to see drug costs when you compare plans? Yes, indeed, I do. I'm going to say both for retail or mail. So I want to try and get the best output that I can for my case here. And then it's going to allow me to add some prescription drugs. So in the old Plan Finder, where you can sort of save these lists, you can no longer save lists of prescription drugs for a client in the new Medicare Plan Finder unless you log in. So if you run this for a new client this year, and let's say you don't sell something or they don't buy something, and you got to go back to them a couple weeks from now, and you never logged in, if you want to do the comparison again, you're going to have to re-enter all the drugs. That's just the way the new Medicare Plan Finder is going to work. If you log in, then it's going to save everything if you do the login. So if your client's husband, wife, whatever it may be, create accounts, and then you do your comparisons, now they'll actually have to be there with you, and you'd have to log into their account to really do this, which is another hurdle in itself. Is it a HIPAA violation if they give you the info, or what about if you're just sitting across from them? So it gets a little dicey there, but if they have an account and you're in there with them working in their account, you can add prescription drugs. So we're working with somebody not logged in right now, so this is not going to save. Let's just add a couple of prescriptions. And you can see it looks similar in most respects to the way that you could do it under the old Plan Finder. What should we add? Let's just say, how about total? Add prescription. Gives you the option to do a generic. I want to add to my drug list. So I got 2 prescriptions added right now. Let's just say, now we can put in a pharmacy. I'm going to pick CVS, no specific reason. Now I'm going to hit done. Here we go. So now it's going to start comparing some for me here. But look, here's your sort plan options. By drug cost, yearly drug cost deductible. So does the plan have a deductible or not? Which in many respects doesn't always matter, because we kind of look at total overall cost. that you're going to spend. And I think that's always been the most important thing is how much is my client going to spend this year with this plan? Premium, deductible, drug cost, lump it all together for me. What are they going to spend? What's the best plan option? Or monthly premium. Again, doesn't really give you that total encompassing option. So let's just say lowest drug cost. So you can see here, this plan from Highmark is giving me low drug costs. But look at this. It's $156 a month premium. This one's a $21 a month premium with a $415 drug deductible. And then there's some co-pays on the prescriptions that I put in there. You can view those drug co-pays right here. So you can see it really hasn't sorted it in an overly useful way. How about this one, $17.20? It's got a deductible. We got some co-pays. Is this the best option for my client? Look at it this way. It's giving you the data, but it's going to make you do some math. You're going to have to add this up to sort of figure out which is the best option for my client, right? You can compare a couple of plans the way you could under the old one. So you can see there are some changes. You're still going to be able to compare the plans. It's not going to give you the ability to save anything with the new one unless you log into an individual client's account, which means they got to create an account. And if they do that, then it's going to save the prescription drug info. Next year, if you go back to the same client, Mr. or Mrs. Jones, will say husband and wife, and you want to see which is the best plan for them in the following year. If you never logged into their account and entered their prescription drugs, you're going to have to re-enter them. That's just the way the new system's going to work. So it's a little bit off of what we were used to. It's a little bit off of what we would think is the best way to do it. It is what it is, I guess. This is what we're going to be dealing with in the next month or so, and I'm sure over time we'll all get a little bit more used to it. But it's certainly going to be a little more limiting than the previous version in some respects. So, what are some options? So, as part of this webinar presentation today, one of the things I wanted to talk about with everybody, and I was looking at who was signed up for the call today. And a lot of you are already working with Pinnacle Financial Services. So we do really appreciate you working with us and doing business with us as a partner out there. And one of the things we definitely think we're on the top as far as top echelon as far as FMO partners is that we give a ton of technology to our agents. And we give a ton of technology to our agents at no charge. Work with us. Everything we have, you get. Just work with us. One of the things I want to talk about is our comparison tool. So we here at Pinnacle Financial Services have a comparison tool called Connect for Medicare. So Connect for Medicare, and I'm going to show you this in a second, it's going to allow you to do everything that I just showed you. It's going to allow you to do things in a way that is going to be a little bit more efficient. It's going to save all your clients' drug information for previous years. And drum roll, it's going to let you actually enroll the client through the system, get paid, be agent of record, and be done with it. So, yeah, you know what? You can go and knock yourself out. We can go and work with the new Medicare Plan Finder, just as we did before, and there's some challenges, as I discussed with you there. But what if you're working with Pinnacle right now, and I was going to give you the ability to use a tool that did all the same stuff, compared all the same plans, but then also allows you to enroll a client electronically, also give you the ability to do a scope of appointment electronically, allow you to save your client's information, allow you to save the plan information you wrote, the prescription drug information into there for future use, and write the business and be done with it. All right, so let me get into this real quick here. So I'm going to log into the system. All right, just before I get into this, I'm going to just knock out on a couple of questions here that we do have. First one, is the old Plan Finder going away? Great question. I did mention the old one is going away. All right, so I got a couple of questions about the link, which I said I can send that on over to you. Send me the link. Okay, question about the electronic scope. So I'm going to show you how to do the scope electronically here with our Connect for Medicare system. All right, let me move right on. So here's the dashboard on Connect for Medicare. Every agent working with Pinnacle, you get this automatically, no charge. You get your own login and password. Every single company that you're contracted with is going to show up here that you can do business, you can compare, you can save your clients and then enroll them and get paid and be agent, all that fun stuff. So first off, let's just say we want to start a new individual. Let's just say start consultation. I'm going to just make up some client info here. So if you see here, you got some asterisks next to the required info. I would tell you it's a good idea to put in everything in our Connect for Medicare system, because if you do end up enrolling a client, anything you've entered in this spot will automatically roll over to the enrollment part of the process, so you don't have to retype the info. It'll save the info in here. So you might as well throw in their phone number. You might as well throw in their address to make sure everything is saved. All right, so we are in Pennsylvania, 18974. You can put in an email address. Just going to put in some basic info, hit continue. Here's our scope of appointment section. So we can do an e-scope. And look, the information I put in there, that email address on the last screen, as I mentioned, if you put it into that profile section, it's actually going to go along with you so that you can continually enter that information, which is always good. Now you can also, if you want to do a hard copy scope, you can do a print SLA. It'll give you the generic scope right here that you can print it off and you want to do a hard copy. The 2020 version of Connect for Medicare is going to let you store scopes in there. That's an upgrade for 2020 sales. Those of you that have been using it in 2019, that was something that we listened and heard as a value add into our system. So we got the IT people on it, and for 2020, you are going to be able to store PDFs of scopes in here as well. Even if you do an email, an electronic scope, it's going to store that PDF version of it as well. So that's a great enhancement, I think, for everybody. So hit continue. Let's just say we're not going to do the scope. We don't have to do it through here. So here's the 18974 based on my date of birth. Let's hit continue. I'm going to say they're not eligible for any additional coverage. As you're looking at this, those of you that have done Medicare.gov's Plan Finder before, you can tell it's a lot of the same questions that you're used to answering. So as you're doing a comparison in connectformedicare.com, our system, you're going to see it's very, very similar and very easy to use, just like the Medicare Plan Finder was previously on Medicare.gov. All right, here's that ability to enter prescription drugs, as I had done before. So what did I do last time? I did lisinopril. Let's just add that prescription. And what did I do? Topril. All right, I'll add the same two drugs as I did last time. Hey, what do you know? I can add a pharmacy. Here's that CVS. Let's just add it because it's the same one I added last time. Okay, here's our comparison. Now, our system is going to compare Medicare Advantage. It's going to compare the prescription drug plans. These are MA-only plans, so there, as many of you know, there are some niches, like veterans, for example, where an MA-only plan might come into play. And then also, how about Medicare supplements? Imagine being able to work with a client in this system, sell them their PDP and their Med Supp right here in one system. Or you can do the combo Medicare Advantage plans. Of course, that'll take care of all the different needs. Let me switch over to the PDP plans because that's what I was looking at on the new Medicare Plan Finder. So here's the new Medicare Plan Finder. So I got 156 drug deductible, retail pharmacy, $21 premium, $59 premium, $80 premium, $17.20 premium. Here's my deductibles. Here's my co-pays. You're doing math. Let's go back to my system here, which is going to do it by total estimated cost. Beautiful, right? It's exactly what you're used to being able to do on the existing Plan Finder that's going away. So now you've got the premium plus the drug cost, giving you a total estimated out-of-pocket cost. This is total cost for your client for the upcoming year. What's the best plan for them? Don't monkey around with me on premium versus drug cost. What's the out-of-pocket, right? And you can see here, it's going to go right in line. What's the best plan for this client? Regardless of what the premium is, it's going to give you the total out-of-pocket. And then, of course, you can actually enroll them in the plan, right? You can email a quote to them. Let's say you're working with somebody over the phone. Imagine being able to email them a quote and being able to do a telephonic sale. You can do it with this system. They have the ability to be enrolled telephonically when you're working with them with our system. And again, your agent of record, you're going to get paid just as you did a paper app. View details. You want to view the details, you can do that as well. The same thing. You want to view costs per drugs. Here's your CVS. You want to do pharmacy directory. You want to check out the other pharmacies. It's got a plethora of information in here. Summary of benefits, formulary, all the information that you're used to getting from Medicare.gov. All the information is in one spot here through our Connect for Medicare. And it gives you the ability to then enroll them. It gives you the ability to save their info, to save their drugs, to save that client info for next year's sale, to do the scope of appointment, to save that information in here because, as we know, that's required, right? We got to save that info. Okay. All right, let me go previous. I'm going to go back to the comparison. Before I go to the comparison here, let's do a quick quick breakdown. You can see the pharmacy cost, and then you can also see the mail order cost, just like you could in Medicare.gov. It's got all the info here. It broke it down monthly for you. The information in here, once you use this once, if you've done Medicare.gov, it's going to look identical. Even if you haven't done Medicare.gov, you can see the amount of time it took me to just do a comparison for a client. And if you hit the enroll button, it's going to go to enrolling the client. It's going to move over the information you already added for them, and it's going to allow you to do an electronic signature and complete the sale. It's a great way to enhance your business. What's the old cliche? Work smarter, not harder, right? Let's make sure that we're being efficient, right? We only have so much amount of time when it comes to AEP. When we're trying to see as many clients as we possibly can. So really important to be efficient. This is going to give you the ability to do all the companies you're contracted with because obviously there's an enrollment feature. So if you're not contracted with somebody, we got to make sure you don't accidentally hit enroll or if you send a comparison to somebody, they don't accidentally enroll in something that you're not contracted with. So we always have to talk about who you're able to sell. The company terminology is, are you ready to sell? And that's what they look for before you submit an application. So let's look at the Medicare Advantage plans. Here you go. You want to enroll, you want to do a comparison, you want to send a quote to a client, you want to view the details. Again, total estimated cost. It's going to give you that information here in one spot. First question, are you contracted with Pinnacle Financial Services? Yes or no? If yes, what carriers do you have with us? Do you need to add any carriers for this year? As we know, plans always change. 2020 plans, are you up to date on what you need to be selling. And then the third thing, do you have your login for the system if you are contracted and ready to sell with any carriers with Pinnacle Financial Services? If you answer no to those questions, you're not contracted right now, it's not too late. Listen, if you need to get up and running because you're looking at this new Medicare plan finder and seeing some of the challenges, you want to be able to enroll individuals as opposed to just running the quote and then pulling out a hard copy paper app, or transitioning over to, say, the e-app feature of a specific carrier. If you want everything in one spot, we can still get you contracted, get you up and running here before AEP. Let me take a quick look right now, see if there's any additional questions have popped up since the last time I looked. The question is, can we take the client's info over the phone and input to enroll for them? The information you can absolutely put in for the client. There is an e-signature feature, so a couple of things. So if the client's there, easy. We can click an e-signature. If the client's not there in person, you can send the e-signature electronically to them. While you have them on the phone, you can get them to open up the email, walk them through it. I know everybody's not technologically savvy, so you're going to have to work with them a little bit on the e-signature section if they're not actually there with you. So that's something you'll have to deal with. Let's talk about questions. I'm going to go down here. I got a bunch of questions, so bear with me as I read them. There's a question about other carriers. We do have an additional system we make available. If you want to see every single company, whether you're contracted with them or not, we actually give a whole different tool that makes that available. Our Connect for Medicare system, you got to keep in mind, this is an enrollment tool. It does all the comparisons and everything, but at the end of the day, somebody can hit the enroll button. And if you're not contracted and ready to sell, that can just lead to a bunch of different problems. So if in the Connect for Medicare system, you're going to see the companies you're contracted and certified to sell. If you want to see everybody else, I have another tool I can give you at no charge. You can run everything, and you can then go into Connect for Medicare and pick the one you want to enroll them in and do it that way. So we've got some workarounds on that. Let me continue with the questions. If you're contracted through an agency with Pinnacle Financial Services, so even if you're working with one of our preferred agencies, you can absolutely have access to this system. So again, just call us here at Pinnacle Financial at 800-772-6881, dial extension 7731. You'll get to our sales team, and they can get you access to this. If you are contracted and certified in any way, shape, or form with Pinnacle right now, you have access to this system, even though you might not realize that you do. The password is automatically set up. So you just got to call and we'll give you your password so you can get into there. There's a question about other carriers. 2020, this is the 2019, so 2020 is going to show a bunch of additional carriers. WellCare, for example, is an additional carrier being added to the system for 2020, so we're really excited about that. There's a lot of new players in the Medicare world coming up for 2020 that are going to be added to this. Oscar Health, for those of you that are going to fall in the couple of areas where Oscar has a footprint, is going to be available through here. So there are some additional companies coming for 2020 sales. Obviously, we can't do 2020 sales until we get the 2020 plan info all finalized by all the carriers. So come October 1st, we'll have 2020 all ready to go for everybody. So there's a question about the regional companies. Yeah, we've got the regional companies like Oscar. We're going to have them out there. If you want a full list of the companies, when you call, we can just walk through all the companies that are available on there. Yes, I can send you information on the other tool. No problem there. Yes, you will be able to see the client's information when they do the e-signature. So you'll get confirmation if you're doing a telephonic app and they do an e-signature, you'll actually get a confirmation in your Connect for Medicare system that the enrollment has been done, letting you know that, hey, you don't have to worry about that client, they've enrolled. And our team here will actually have eyes on that enrollment the very next day. So even if you call us the following day, we can tell you if Mrs. Jones actually did the enrollment or not. So the question about can you do the SOA on the system and use carrier enrollment portal? That's a really good question because I have agents right now that do all the comparison, all the network lookups, the physician lookups, all the prescription drug comparisons, and still use paper apps and still use the enrollment tool of the carrier. You don't have to do the enrollment through Connect for Medicare. It just gives you the ability to do that, but it gives you everything else. So if you want to do comparisons, you want to save your client's drug information, you want to look up networks for all the different carriers, all that information is in this portal. And then if you want to pull out a paper app and submit it like you always did, knock yourself out. Absolutely. So no problem there whatsoever. So the question about what the client sees when they get the enrollment email, we can walk you through this one-on-one, but they just simply get an email that, let's say Bob Brisky, myself, I'm sending it. They'll get an email that says, Bob Brisky, I sent you information on your Medicare plans. Click here to get that information. So they'll click on that link that comes in that email, and it'll open up this comparison. So if you send them Humana and United Healthcare, they're only going to see the ones you sent them. So they're going to see Humana and United Healthcare, or just United Healthcare. Let's just say you zeroed in on United Healthcare, and that's the plan they're going to sell. Just do United Healthcare, send it to them. They open up the link. They're going to see just the United Healthcare plan info. Hey, Mrs. Jones, here's the plan info we spoke about. Here's where your out-of-pocket costs are, the premium for the plan. If you hit that link right there, we're gonna be able to enroll you right over the phone. Let's walk through that process. So you're going to be able to do that if you'd like. Let me see. Is there a CRM functionality in the system? So as far as this, for those of you, everybody pretty much at this point knows what a CRM system. So a CRM is going to house data for you to be able to manipulate. So any information you put in here is going to save that. So you can go under search profiles. You can pull up a client. It's going to give you all their prescription information, what plan you quoted them, what plans you enrolled in them. It's going to be a living history of your clients, and you're going to be able to run reports off of that. So let's say next year, United Healthcare is pulling out of a certain area. You want to pull up all of your United Healthcare clients that you did through Connect for Medicare. You can run a United Healthcare report from Connect for Medicare. So you can see, hey, I got 30 clients that have United Healthcare in this county that I need to move, and you can zero in on those individuals. So it does have a lot of that CRM functionality in here, which really is very useful. So there's a question about the doctors. Yes, you can look up every doctor in here. So if you want to look up whether or not a certain doctor is in a network before you sign them up, which you should always do, obviously, you can do it right here in the system. Any of the plans in here, all the provider directories, information is in here. All you got to do is click on that plan info, and you can go right to the provider directories. If you really want to get into it, call your salesperson, the extension 7731, and they'll do a one-on-one walkthrough with you. They'll make sure you got your ID and password for the system, and they'll show you how to get to that. It's really simple, and everything's in one spot, which is great, obviously. There's a question about whether or not you're allowed to do enrollments online. Absolutely. I think all the carriers at this point prefer that you do online enrollments. It's really, listen, we have no problem with paper. We have an enrollment team actually in our office. We're one of the few FMOs that actually houses in a staff of people that are just enrollers, so they're very good at it. So we'll take paper all day. That's no problem. But I think when you take a look at a tool like this, you see all the advantages of it. You want to do an online enrollment? Absolutely. We've done thousands through Connect for Medicare, the system we've been using for about a year and a half now. And it's really taking off. It works. You get paid. Your agent of record. The information's there. The agents that are using it really do love it. It's just a matter of getting yourself set up. Make sure you got the right carriers in there for yourself. There was a question about the amount of companies. Just keep in mind that we have a plethora of the major carriers in here. This is a test environment, so we've got not all the carriers in here right now just for test purposes. And just remember, the carriers can also vary by the zip code that we're running. So I'm running a Pennsylvania, Bucks County zip code here. So obviously, if you're in Des Moines, Iowa, you're going to possibly see some different plans than I'm seeing here when you run it. And also keep in mind, if you're doing special needs plans, SNP plans, a lot of the major carriers like United Healthcare and Humana, Aetna has their SNP plans approved for us to use in this system as well. So you can also do SNP sales in here, so all year round, which is really nice. Question about the scope of appointment. If you do an electronic scope, just keep in mind when they complete their part of it, it's going to come back to your Connect for Medicare system. It's going to notify you that Mrs. Jones completed her portion of the scope of appointment, and there's a button there for you to click on to submit that scope and electronically sign it yourself. So not only is the client electronically signing it, you as the agent is electronically signing it. And again, for 2020 sales, it's going to house a PDF of that version of the scope that you signed it, they signed it. Not only Medicare Advantage plans, if you marked off the HIP plans and the dental plans and the other stuff, everything that you did with the scope is going to be there and it's going to be saved for you. Yeah, so I'm getting a lot of duplication of questions, so I think I've answered a lot. I'm sure it's one of those things where once you get, like anything, once you get in it and kind of monkey around with it yourself, you get a better idea of how easy it is to use. Like I said, if you are contracted already, I can give you your ID and password. You can get in there. We can sort of mess around with this together, get with your salesperson in our office. I have a copy of this recording I'm going to make available. I know there was a couple of questions about the recording on this, and as long as you put a note into the question section, I'll make sure you get a copy of it. We're going to put it out on our YouTube channel as well, so we make sure that we try and get all the pertinent webinar recordings out there for consumption. So I'll make sure I get that out there as well. Our toll-free number again here at Pinnacle is 800-772-6881, extension 7731. If you want to email questions, email them to sales@PFS. So Paul, Frank, Sam, PFSinsurance.com. Sales@PFSinsurance.com. Say, hey, I was on the webinar and I need a copy of the recording, or I have additional questions I want to talk to somebody, and we'll make sure somebody gives you a call back to go over it. We really want to make sure everybody's up to date on all this, make sure that everybody has the best AEP, make sure that you have all the tools that makes you more efficient. So don't hesitate. Reach out to us. We want to be a resource for you for not only AEP, but all year round. So for that, I'm going to end it here today. I appreciate it. We went right about 40 minutes, so I'm right on target. Hope everybody has a great rest of their day. Look forward to an awesome, successful AEP, of course. And please don't hesitate to reach out. Let's get going with Connect for Medicare and make sure that you're good to go. So let's get rolling with that. Give us a call. Thanks, everybody. Have a great rest of your day, and we'll talk soon. Bye-bye.